kind of what I'm going to be covering tonight. I do want this to be very informal. Feel free to raise your hand and ask questions as we go along. I'm good with that. Or if you want to save them up till the end, that's fine. I like to kind of touch base with you all, kind of let you know what's going on from a nursing perspective on our side and a personnel perspective. I'm not going to blind you with science, which is what Michelle, our secretary, always says, you know, that somebody called with lab results and they were trying to blind me with science, Cindy. But I just like to kind of tell you on a practical level kind of what goes on in our program and where we are today, because I know that sometimes when you're transplanted and you're involved with us for the first year post-transplant, you kind of know who the personnel are and what's going on, but after that, you know, we see you kind of once every 3 to 6 to 12 months, and you kind of lose track of that. So we work very hard to provide a pictorial tour of our program. Also, I've kind of provided a little bit of program statistics so you can see kind of how big we've gotten, and kind of let you know what our current protocols are for heart transplants. It may not affect a lot of you because you're out further than a year, but just to kind of let you know what's going on with our current patients. And then kind of talking a little bit about what happens, you know, the long term and the short term, as far as what we're trying to avoid and look for in heart transplants, you know, as far as health issues go. And then, of course, the time for question and answer or discussion or sharing your story. You guys have great stories to share, and I have nothing but the highest respect for you. That's, I think, why I've stayed in this job for as long as I have, because you guys are an awesome group to work with, and it's just really a privilege to be involved with your lives and be able to help you through the process. So, that being said, we have new surgical staff that's come on. Many of you may know Aki Ito, Dr. Ito. He's kind of the veteran surgeon in charge. Dr. Silvestri actually ended up leaving our program about a year ago. And then next in charge is Keki Balsara, who's actually had a lot of experience and comes and joins us. They both do quite a few LVADs. Our LVAD program is still very, very active. And then recently we've had Dr. Masood join us from the University of Michigan. He did an extended residency and training program in heart transplant and LVAD implantation, so he's kind of there to aid assistance. We're very, very busy on that LVAD side still, so we keep them quite busy. And some of you may have seen Aki around. He was kind of second in command behind Dr. Silvestri, and very involved in the surgical side of things. We do have a joke. We call it the Aki and Keki show because that's their. We don't get tangled up in all their names. Sorry about that. And you may recognize some of these nurses. We have, of course, Natalie is still our veteran LVAD nurse, and then we have Denise Manker on the end, who's also next in line, and Christy Kay, as well as Danielle Hoff, who are our LVAD nurses. Many of you have had experience with them. And then we also were privileged recently to get an addition of LVAD equipment person, and that's Katie Glass, who's in the green right there. Because the LVAD program has so much equipment and is toting it back and forth to the north and south campus. Literally, you saw the blocks that we have to tread. We needed a person to actually kind of be in charge of the equipment and where it was going to be on the south campus and where it was going to be in our office. And kind of we have an entire storage room devoted to LVAD supplies within our floor in the Center for Outpatient Health. So Katie kind of organizes that and makes sure the equipment is where it needs to be when it needs to be there. Next, we have our wonderful administrative assistant staff. Many of you talk to, oh sorry, I don't have this thing down yet, sorry. We have Debbie Hale. She's on the end there. She is great as far as scheduling things and getting things done. We have Deb Tallis next to her, who primarily assists the LVAD nurses and Dr. Ewald. And then we have Michelle Buggage, who's also one of our main kind of administrative assistants. And then we have a recent addition of Charisse Yates. So they've gotten additional assistance as well. Sharice's claim to fame is that her uncle owns a barbecue place, so she frequently brings in good food for all of us to I'm pretty sure that's why she got the job. Many of you know, so we're kind of letting you know our structure on our side. We've arranged the nursing support staff by physician. Many of you know the veteran Dr. Geltman. He's been around for quite a while. He actually did his cardiology fellowship at WashU, kind of did general cardiology for quite a while, but he's an awesome veteran doctor. And Lana has been a great friend to many of you. Lana and I job shared from about 2000 until 2009. I had my last baby when I was in 2000 and was able to work part-time, and Lana was my partner. So Dr. Geltman's an awesome cardiologist. Many of you don't see him because he doesn't do a lot of the outpatient post-heart transplant stuff, but he does do rounds on the inpatient side. And then many of you may recognize Sandy Shipke. She was a nurse on 8100. She's been a nurse there for about 20 years. Very, very good cardiology background, and she's joined our team recently. Barnes has had a little bit of mercy on us and provided us with some new nursing support staff, so that's been awesome. Yes. And then we've got Dr. Ewald's staff. Many of you know Jill, and then Janice is her sidekick as far as that goes, and then Heidi Craddock. Heidi's actually doing a lot more of the LVAD stuff right now, but many of you knew her on the pre-transplant side of things, and she used to do our post clinics out west, but now she's kind of pretty much running the LVAD side of things. And then of course the veteran Dr. Ewald, that we're always out to show that we're a little bit better than he is, but we never. Yeah, exactly. And then we got Susie Joseph, of course, who's a wonderful addition to our staff, and her nurse, our recent, another nursing position that was provided for us is Penny. Penny came to us from the recovery rooms of the OR, so she kind of knows the surgical side of things. Been great to kind of assist us with that. And then, of course, there's Dr. Justin Bader. He's a local boy. He graduated actually from DeSmet. Very, very bright guy. He joined us last July, and he's been wonderful. And then Sharon, who's here, is his nurse assigned to him, and I predict that they'll be very busy very soon. He's been great though, and many of you will see him in biopsy clinic or in the clinic out west. It's been awesome. And then Dr. Shane LaRue as well joined us 2 years ago, and Beth, who used to be with Dr. Joseph, transitioned over to being his nurse coordinator. And Dr. LaRue also has West County clinics as well as downtown, and is very active in the cath lab and in biopsy clinics. So many of you will see him. Again, we've got great cardiologists. They're the smartest guys I know, and they do a good job. They really do care about our patients. The other interesting part of our program, which adds a great dimension to our care, is the guys we have doing research. Many of you have seen these guys in biopsy clinic because they're very, very interested in post-transplant care and management. They're all very, very active in research with regard to the immune system, with regard to the drugs that regulate the immune system, with regard to management of post-heart transplant issues. Dr. Holly and Dr. Schilling have been designated as being 25% clinical, so they do our post-transplant clinics. They do round on the inpatient service from time to time, but 75% of their time is spent in their research projects. And Dr. Schilling and Dr. Holly are both very, very bright guys. Dr. Schilling has won numerous awards for Young Investigators Club, so we're very lucky to have them. And anytime you have a question about the immune system or the drugs or anything, he's always willing to kind of share his knowledge. Been an awesome guy. He's also a guitar player on the side and plays in a band, so we get him to play for our Christmas party once in a while. And then Dr. Levine, many of you have seen around. He's actually finishing some research, some of his fellowship, but doing research as well. And you'll see him in biopsy clinic. Very caring guy, very awesome with our patients as well.
Yeah.
And then we couldn't not add our fellows. Of course, Dr. Hardipee would not send us a good picture. It's interesting when you tell guys to send you their selfies, how much resistance you get. What are you going to use this for? Really? Can't you go to the website?
Yeah.
So, but of course, Dr. Jonathan Davis was from California, and he was more than happy to take a picture. He's been an awesome guy. We're very sorry to be losing him after he's done with his fellowship. He's going to Portland, Oregon. He's originally from San Francisco, so it's a little bit closer to home, but he's been an awesome guy with our patients. And then Dr. Hardipee will be here another year for doing research and finishing off his fellowship. And then we couldn't not include the rest of our personnel. Ms. Jarvis. Go. Take another glass.
You're a nurse, you should know.
Yeah. Let me have another sip of it. Now, the girls tried to get me drunk before I came here. I just want you to know that. So if I say things that are way out of line, just let me know. Nina's been great. You know, the hard thing with Nina, and I know that some of the heart transplant patients have felt kind of neglected, Nina covers the entire LVAD service, which is at any given time about 180 patients. And she covers our heart transplant patients, and she sees our evaluations. So at any given time, I'm serious, she's seeing about 300 patients. We're lobbying to try to get more social work support, and Nina had the, she had the opportunity to go to Vanderbilt recently, and she shared with me that Vanderbilt actually has 4 social work personnel that service. She has they have a return to work social worker devoted entirely to helping transplant patients if they can't return to their previous job, helping them to do both rehab and help them to get the education and the resources that they need to find a job that's meaningful to them. They have 2 coordinators that work with the post-heart coordinators, post-heart transplant patients, and then they have 1 that works with the pre. So we're hopeful that maybe we can at least get a little bit more support. But she's been really awesome as far as when we call her for, assistance and help. She's pretty responsive. And then Katie Lambert, our dietitian, is a great resource as well. She's got great ideas for diets and exercise. She lives it. She at one point was very heavy set and took up running and took up healthy eating, and so she can tell you how to do it because she has personal experience. And then Sina's been great as well. She has a social work as her background. Sina's actually out on with back surgery right now, but we hope that she'll be back within about 3 weeks. Everything went well, but she's been an awesome resource. And later on I'll tell you this, but anytime you face insurance issues or insurance changes, it's a great idea to contact her or Nina to kind of get an idea of whether we are going to take the insurance and what the future holds. And again, that's an ever-changing thing, and sometimes they don't know, but they'll find the answer for you, or at least try to. So this year is a very special year because actually in January we celebrated 30 years of doing heart transplants at Barnes. That's really awesome. I mean, in January of 1985, I look back, we transplanted a man that was actually a golf course manager from Michigan. He was listed one day and he got transplanted the next. It's an interesting era back then. I actually joined the program in 1987. I knew Larry Elders, who was our first heart transplant patient, awesome guy and very, very, very appreciative. But he was listed on January 9th and actually got transplanted on January 10th. I looked at the waiting periods back in the first year, and there was an average of about 30 days total. But it was also a different, time. I mean, we had our own donor coordinators that were assigned to our hospital. We competed directly against St. Louis University Hospital, who have their own donor coordinators, and there wasn't near the national kind of regulated system that we have now. I also want to bring up that the last transplant performed in 1995 was done on December 30th, and it was Nick Belfiglio. And Nick, as many of you know, passed away this past year. Did I say 95? 85, sorry. Oh, shoot!
I'm the spy person, so.
1985. Sorry, guys. Golly, that's a
Okay.
huge typo.
Yeah.
Sandy? Gosh. Anyway, 1985. But Nick was a great guy. He kind of broke me in and trained me. The interesting thing about Nick is that he kept a book for all the medicines he ever took and ever was tried on, and if you try to start him on a new medicine, you'd be like, I'll get back with you on that. He threw his book and literally, fine. You know, they tried that on me in November 10th, 1997, and this is the reaction I had against that. So it was pretty interesting, but he was a great guy and really died at the age of, I think, 84. So he got good use out of that heart. He was a pretty neat guy. He sent me a Christmas card a year ago and made me cry. It was very, very sweet because he was kind of a crusty old guy. He didn't like give compliments easily, let me tell you. It was fun though. So this is an interesting little old statistic. I asked Debbie to kind of pull up our recent statistics. We actually, within our practice of all those physicians and all those nurses, we follow about 5,458 patients. Heart failure patients, heart transplant, I mean, they're all pre-heart, so all kinds, you know, some of them just have coronary disease, but most of them have heart failure in one way or another. We have 77 patients on our list currently. And that's about average for about the past 5 years, really. We've averaged about 70 to 80. Currently, we have 180 LVAD patients. And again, not all LVAD patients are listed. There's a lot of people that get LVADs just to survive, you know, just to get some more years out of life. That will not ever be a transplant candidate, but they do well on their LVADs and it gives them a few more years. Currently, we follow 436 heart transplant patients, and we get, you know, most of our transplant patients are from our own program, but I will say that children's transitions about somewhere in the neighborhood of 4 to 8 patients a year. So more and more of the kids are making it to the 18, 19-year-old to 21-year-old. We have an ongoing joke, I think I've told you this, the Children's Hospital is so nice to us. They transition the little bratty, total difficult to manage patients when they're 19, Val Hoban.
We were all turning around.
I love Val.
Let the truth come out.
Yes, Tom Aguado. God. And then the really beautiful, wonderful, all-together patients, they transfer about 21 to 22 years of age.
Over at 22.
It's really, and I have to break it to you. We have a lot of 20, 21, 24-year-olds that want to develop their own support group. So we're going to try to get, you know, these kids are different. I mean, they are social media all the way, you know, Instagram, Facebook. So we're going to try to kind of get them together this summer and see kind of what transpires. You know, I don't know, we'll see.
Also on Facebook, Instagram, and Twitter.
See, that's what I think too. So hopefully maybe once we can kind of get them together, maybe we can have them interface. Because I think you guys have a lot of wisdom to share with them. We've had a lot of requests to kind of get the group together, and then maybe we can, you know, provide like a whole, because I know their parents would love it, you know, to kind of get them together. We have a whole array. I mean, they've got very challenging problems. They feel very alone. They don't know a 21-year-old that's had a heart transplant. Lots of them have said to me, I don't tell my friends I've had a heart transplant because if I do, they treat me totally different. So, I mean, they definitely are struggling. We've lost a couple of 21-year-olds, you know, that have had problems and not called, or, you know, it's a very difficult age. So, but, you know, I may talk to you about that and just kind of how to kind of little bit of interface and mentoring with regard to that. The other startling statistics.
I'll work with you on that.
Cool, that'd be awesome.
Sorry.
She's already working with children's on transition. It's one of our
Yeah, that'd be, I mean, it's a work in progress for sure.
Yeah.
You know, and honestly, I mean, it's a difficult thing because the parents try to pull back and let the kids do more, and then, you know, the kids kind of, I mean, aren't used to that.
Yeah, it's a number of things.
Yeah,
I
it's a
think-
complex.
And I think your team would appreciate it. I mean,
Yes.
the children's team needs to know what do we tell these people. So we're kind of
I
working
agree.
on a formal, what I call a graduation, but it's more, the term is probably just transition.
Yes.
Because it's more of just a drop. Here you go.
Yeah.
This is Bart's.
Yeah, and they're very frightened of us. I'm not that bad of a person, come on.
No, it's not you, you know.
No,
But
it
every
is-
biopsy, that team yells at me and they say, your children's patients are too high maintenance. That's not true. That's not true. I just know what I like. I like my person, I like my fentanyl. Who doesn't?
I do laugh at Logan. I know.
They hate.
It's like giving drugs, right?
Although, I gotta share, this is probably a total HIPAA violation. Turn that camera off. No, I'm kidding. Val comes to clinic and goes, you know, once in a while I take a float trip. And I sometimes forget my medicines for the weekend. Is that a problem? Do you see these gray hairs?
Dehydrated and drinking, is that bad?
Killing me now. It's all good.
I don't forget it anymore.
Good.
Reconsider.
Part of-
Me in my early 20s. Now that I'm
Speaking of transition processes.